videos. All right.
Okay. Good evening, everyone. Thank you for joining. My name is Judith Pina. I am presenting to you this evening my journey in mammography. I am a mammography technologist and the team lead for the Breast Imaging Center at Cedars-Sinai Medical Center. I am happy to share with you all that I just celebrated my 25 plus years in this profession, being a radiology technologist. And I've spent 17 years with Cedars-Sinai Medical Center. The reason for my loyalty staying there is because I am a firm believer of their mission statement. Cedars-Sinai is a nonprofit independent healthcare organization committed to improving the health status of the communities we serve through the leadership and excellence in delivering quality healthcare services, expanding the horizons of medical knowledge through biomedical research. So how did I get into this field? Well, one of my parents became very ill, and I was exposed to this unique profession that plays a very important role that contributes to the healthcare and the treatment of the patient. I was immediately inspired, and I knew that this was my calling, to be a part of helping people and saving people's lives. As I walk you through my journey, I will highlight through the lens of my experiences, education, licensure and certification, mammography technologist as a profession, the benefits of becoming a mammography technologist, and why I chose mammography as a career. And I hope that I can inspire some of you to pursue mammography, or at the very least, have this as a post-primary certification. It'll definitely make you much more marketable when you graduate and are looking for a job opportunity. My journey began in the 90s. I attended the Los Angeles City College and completed their radiology program in 2 years. The program is 2 years. I did my clinicals at the Good Samaritan Hospital in Los Angeles, and I earned my degree. I achieved my certifications with the California Department of Public Health Radiologic Health Branch, and my credentials with the American Registry of Radiologic Technologists in the discipline of radiography and mammography. When we are looking to hire a potential candidate, the following are the education requirements we look for. You have to be a graduate of an accredited mammography program. That is a requirement. I am aware that CSUN offers that mammogram program. We also require that you have a certification in mammography through the ARRT. A bachelor's degree in the radiological sciences is always preferred. Having your state of California CRT certification is required. And obtaining your basic life support or CPR is a skill that all healthcare professionals need to know. And it's a requirement to work at any hospital setting or clinical setting. The completion card that you obtain is valid for 2 years. So you have to keep renewing it, refreshing your skills every 2 years and obtain a new card. That's a requirement. In addition to these qualifications, when you're going through the interview process, the job interview process, that is, from my experience, we are looking for someone who is a team player, having great communication skills, having a patient and positive attitude, someone who is open to learn since the learning never stops, and someone who is flexible with their hours, which means having to work overtime if necessary, having to work the weekends, being flexible with any shift changes as they arise. Why these attributes are so important in our work field is because it helps create a great culture with networking alongside other team members, the physicians, and more importantly, caring for our patients. The reason why I'm sharing this with you is because I've had numerous positive feedbacks that I have received from patients. Cedars-Sinai sends out a survey to these patients to receive their input and their experience after they've completed their imaging as a way to measure areas that may need improvement. So the following statements that I'm sharing with you all are from actual Cedars patients. So when they get home after I do their mammogram, the very next day they get a text message, and one of the questions says, "What did you like about your imaging experience?" This patient says, "Judith was quick, pleasant conversation, and considerate." A different patient was asked, "What was the best part of your imaging experience?" Judith's capability and speed during an uncomfortable exam was the best part of my imaging. And all these statements are from different patients. I had to go back and see all of the positive comments I've gotten over time. And I think that the ones that I chose were the best ones that reflect what patients expect and have complete satisfaction. Is there a technologist you would like to recognize? Judith was wonderful. She was an expert at her job, very communicative, lovely and friendly. I felt very safe and comfortable. She is a gem. Did someone make your imaging experience special? I'll always remember this patient because she was in tears. She says, "Judith Pina was a godsend. I had a horrible mammogram in 2016 with a technologist that treated me like cattle and data entry. I was literally in tears," and she was. She was dreading this mammogram, but Judy was so gentle and caring. I can't thank her enough. This reminds me of a quote, and I can't remember who said it. I'm so sorry, a little nervous, but someone said to me that patients won't remember what you do and what you say, but they'll remember how you make them feel. I'm often asked, what is mammography? Mammography is the imaging process that uses low energy radiation to evaluate the breast tissue for early detection of breast cancer and other diseases. Finding the breast cancer early means that the treatment can start early and hopefully before the cancer has spread to the lymph nodes. There are two types of mammograms, screening versus diagnostic. The screening mammograms are for women who have no symptoms or they're asymptomatic. These regular screening exams can help reduce the number of deaths in women ages 40 and above. The diagnostic mammogram is done for patients who are experiencing symptoms such as a lump, nipple discharge, skin or thickening of the skin. Or if they come in for a screening mammogram and the physician saw something on their mammogram that needs further evaluation, then the patient is then called back to come back for a diagnostic mammogram to diagnose the area that's in question. Currently at Cedars-Sinai, we're using the Hologic Dimensions Genius 3D technology, which is, it has the highest level of resolution in tomosynthesis system. As you see pictured here, this is the unit that we use. Your scope of work as a mammography technologist is to gain patient cooperation by reducing anxieties, providing explanations of the exam or procedures and what it entails, explaining the equipment and the importance of the use of breast compression, and answering any questions they may have. There is a different segment of mammography that's also very unique. As a diagnostic technologist, you get to assist the physicians with breast procedures, and these are interventional breast procedures, such as the stereotactic biopsy, in which what that is we take samples of the breast abnormality. They're acquired through the guidance of the mammogram machine. If the patient's biopsy results are malignant or suspicious cells, then the patient needs to have surgery. In order for the patient's surgery to be successful, the patient now has to undergo a different kind of interventional procedure, what is called a needle or wire localization. And then this is where the radiologist precisely pinpoints the area for the surgeon to excise. And all of this is done the same day of the surgery. Over the last few years, we have been performing a procedure that is called a radar or a Savvy Scout localization. This allows a patient to have her procedure days or weeks before she is scheduled to have breast surgery. All of these amazing procedures that exist to help our patients are done with your assistance and your level of expertise as you advance in your career. We also acquire and obtain images of the breast with having a breast implant. And we do that by practicing safety guidelines to avoid potential rupture of the breast implant. So breast tissue compression is used for multiple reasons. One is to decrease the thickness of the breast tissue, thus reducing the scattered radiation, improving the contrast of the image. And by providing a high quality image, you are eliminating the possibility of having to repeat the image, which thereby reduces the unnecessary radiation exposure. All of this is practicing radiation safety. Following the precise instructions and proper use of the imaging equipment will allow you to obtain high quality imaging. The benefits of becoming a mammography technologist. Mammography is a flexible career. You can work for a hospital or you can work for an imaging outpatient facility. There are hospitals who have satellite clinics where they can have you doing mammograms on certain days, and on the other days, you're doing diagnostic x-rays. You can even work as a traveler across the country for an agency that sends you to fulfill the facility's shift needs. And you can pretty much find an employer that suits your lifestyle. Mammography is a fascinating field because This career path demands that you learn about the human body and biology while also mastering the ins and outs of today's modern technology. You'll be expected to know and stay informed so that you can do your job effectively and efficiently. Your job will always require you to know more about the latest innovations and how you can apply them to your field. The physician protocols can constantly change, and you'll need to keep up with the latest developments. So you are constantly learning and using your knowledge to help others. There is a very high demand in the mammography field. This career is in demand across the country. Over the last few years, there has been a significant decline in mammography professionals. And what human resources is seeing is that with a dramatic reduction in professionals, we're just not able to keep up with the demand for the services. So not only can you find employment easily with your qualifications and skills, but you can position yourself to work at a facility that allows you to have outstanding benefits and good pay. Mammography is not repetitious. While the environment can stay the same, the job is intense, and it allows you to put your skills to use to help a new patient every single day. You can be a screening technologist, a diagnostic technologist, or you can be involved with the interventional procedures, which are all very different and have their own challenges. I find that mammography is rewarding. Helping people is extremely rewarding for many, including myself. You get a chance to help someone new each day and ensure that they get the best possible care to overcome their health issues. So the benefits, okay, so we'll discuss the benefits here at this time. At our facility, the starting pay is $50 an hour, which includes health insurance. In addition, you receive paid time off for vacation days, and you get sick pay when you call out sick due to an illness. We offer retirement plans such as a 401k and pensions. Having these benefits help reduce out-of-pocket expenses and are very desirable qualities for a career which can provide a better financial foundation for many. Now, if you already have health insurance through a family member, or you're just not interested in having any kind of benefits that I just mentioned, then you can work as a per diem technologist and get a higher hourly rate. I know someone that's working for a large hospital chain, and as a per diem technologist, she's making $64 an hour, which works out very well for her. And if you decide to work as a traveler, I know a few travelers now that are earning $100 per hour. And they've informed me that some of the agencies do provide or offer health insurance. So like I said, you have tons of options when you graduate. Why I chose mammography as a career? At the end of the day, I feel like helping to make a difference is my calling. I chose mammography as a career to be a positive impact to the community because mammography is about building relationships. When you extend your skills and care onto helping patients, this will have a positive effect and contribute to the mental well-being for both them and you. Mammography is an exciting and rewarding career and field that requires passion, grit, and professionalism. So I hope that I was able to inspire you to embark and pursue this unique field of mammography as graduation awaits you. I am open to any questions that you may have. Concerns?
No, I'll go ahead and ask. I know that not all facilities have the TOMO, capability. That's kind of a newer offering. Is that really kind of the cutting edge? What does it add to the image versus just the standard kind of mammogram?
With 3D technology, we are able to pinpoint the abnormality because the images are reconstructed and are demonstrated in 1 millimeters. There's several slices, so it's kind of like a CT scan of your breast tissue. Versus the original mammography, we still do the 2D imaging. It's still widely used, but the 3D technology is preferred. And it's been shown to have a great accuracy level of where the abnormality is, especially when we're going to do a biopsy of a mass or breast calcifications. With 3D technology, we're able to pinpoint how deep it is versus with a 2D, you're kind of guessing how far away the area is from the nipple or in the quadrant. It's very state of the art. And that's what I love about Cedars-Sinai is that we have the best equipment from Hologic.
Yeah, I was going to say, in California, how many different providers do you think have that Hologic technology versus a lot of facilities are using just the standard 2D or the mammogram?
From what the engineer has told me, there's not very many with a Genius 3D because it's very expensive. But I don't have the number. I know that the smaller clinics wouldn't have it, but maybe the other larger hospitals would have that same equipment.
And it's covered through in typical insurance, is it?
It is covered through insurance. At one point, when we first started doing that, it wasn't, only if you had dense breast tissue, I believe, but now it is covered by most insurances, I should say. I remember there was a patient we had that called her insurance and said that their insurance wouldn't cover it, unfortunately. So there are still those kind of insurance companies that really won't or aren't really for the patient, I guess, and are limited.
Yeah, using that new technology, do you have to go through a separate new training for that new machine? Does Hologic provide that, or are there schools that are now adding that to their curriculum?
I'm not sure if the schools are adding that to the curriculum, but Hologic did provide the training in-house. So when you start your job, wherever you begin your job, at whatever facility, if they purchase the equipment from Hologic and get that 3D imaging, then Hologic sends out a representative to train the entire staff in it. So there is a training process that occurs. But it's not a requirement to get a job to have that training. Yeah, so in fact, we've had new employees that have only worked with 2D equipment and have never worked with 3D imaging, and we just cross-trained them in that. They didn't have to actually take the Hologic course to do it.
I'll let other people go, but I do have a couple other questions. So does anybody else have one? I'll ask, so what's the main difference for the diagnostic that you do that's different from the screening? Is it just a specific area of the breast that you target, or is it actually a different type of radiation, or it's a different, yeah, what are the differences there for screening versus diagnostic?
So the screening mammogram is when a patient comes in for their annual evaluation, and we just take 4 pictures. It's two views per breast. With a diagnostic imaging, that requires more pictures. So the level of radiation is the same, but the angles that you obtain on the diagnostic mammogram are different. We do spot compression over areas of asymmetry, or if there's a mass, we use spot compression views. If the patient has calcium deposits, then we would need to use magnification views so that the doctor can better delineate those calcium deposits. The main difference is with a diagnostic mammogram, there is an area that we have to evaluate if they were called back from a screening exam. So if you come in for your screening exam and there's an area that the doctor wants to review, then we have you come back for the side of the breast that's in question. And sometimes it could be both breasts that are in question. So the views are different, and it all depends on what the initial call of the abnormality was. If it was just unilateral or bilateral, then that would change what the study is. Now, patients who have personal history of breast cancer, for their first 5 years, it's recommended that they do get a diagnostic mammogram. So the pictures are the same as a screening exam, and every facility has a different protocol. So our facility, we do take additional imaging to include with a diagnostic mammogram, and that diagnostic mammogram is the patient's screening exam. So for the next 5 years, a patient who had breast cancer will have their annual diagnostic routine mammogram, where we add additional magnification views to the surgical site so that the doctor, the radiologist can see if that where the area was removed or the lumpectomy bed, if there is any new developments and stuff like that. Then with the magnified images, they're able to see if there's any reason to rebiopsy the area. So that patient that has personal history of breast cancer is monitored for a period of 5 years. Then after that, they resume to their screening exam. They don't need the additional pictures anymore, and they could come once a year. I hope that was that
That was
helpful?
really helpful. Yeah.
Yes.
And also just because I am in sonography, where do you see kind of the benefits of doing maybe this? You said there was the mammography guided biopsy versus a sonography guided biopsy. Are there benefits to one or the other?
Well, one of the benefits I feel personally that the ultrasound biopsy is much more comfortable, if you want to say, for patients, because they're laying down on a gurney and the doctor numbs the breast area with local anesthetic and the patient is relaxed laying down. For the stereotactic mammography biopsy, the patient's a little more active, where they their breast is being compressed in the mammogram machine, and this can be done in a seated position, or our facility has the prone biopsy table where they're laying face down. So as far as my experience is that patients do prefer the ultrasound, but The drawback is that ultrasound, you're not able to see microcalcifications. So if the patient has abnormal microcalcifications, the only way to see these areas are through the X-ray or the mammogram. So those always have to be done under mammography, stereotactic biopsy. The ultrasound biopsies are done on masses or breast tissue that's severely distorted, and there's enhancement that comes through where that's highlighted and the doctor is able to do a biopsy that way, because under the mammogram, it's not very well differentiated. So then with ultrasound, it has bells and whistles that will enhance the area and make it easier for the physician to biopsy. So they're both very important. Stereotactic biopsy and the ultrasound biopsies are very important, and they both systems see very different things. So I get patients who say, I just want an ultrasound of my breast. I want the whole breast scanned with the ultrasound because it's not going to hurt. And we inform them that that is not the gold standard of breast imaging, just doing the ultrasound. We have to, it limits us what it can see of abnormalities in the breast tissue. So if the patient just did an ultrasound, we can see these microcalcifications, which could be suspicious for breast cancer. And that's why getting the mammogram is the gold standard of breast imaging.
And Sam, I know Sam did a presentation on AI for the recent conference. And I wondered, did you touch on any of the breast AI, Sam? Is there any crossover here?
Not that I saw, like there's so much information. I didn't get a chance to touch on like every single modality that had AI, but I don't know, Judith, do you know anything like in regards to AI usage for mammography?
Not at this time. I actually, it's news to me. I haven't heard of it potentially being in mammography. What is it? What was your presentation? AI in which modality?
So it's like AI in like radiologic technology. So it's like I kind of found stuff like with MRI, CT, I think I might have found something with mammography, but I don't remember. But I think I found that it can help like to detect like strokes in patients like faster than like someone reading it, or it can like notify the physician like right away. Like, so indicate like if there's something abnormal that it can be taken care of sooner rather than like a little later. There's like various information.
Oh, wow. Very interesting.
Yeah, but I don't know if I saw much on mammography usage for AI, but I think like there's probably some information out there.
Yeah, I do know in the ultrasound breast area, it's really big. And I don't know how many facilities are implementing it yet, but I know the research is pretty solid and that it's really effective and it's very efficient. And the sensitivity and accuracy is really high. So as far as like detecting malignancies, the sensitivity and the specificity is really high. So they're doing a lot of stuff on this right now. And I wasn't sure if it was going over into mammogram as well.
Yeah.
So that's
I'll
really
keep an eye out for that.
Yeah, I think like
with the tomosynthesis, I mean, it's already so amazing. So that's great.
Yeah, and I think the common thing I found like across like when I did the research is that like it can help find malignancies or like little cancers that are usually can be missed by the human eye. That can be like, hey, like this is like an area like might be able to detect it, like things that like maybe like not visible to the human eye.
I see.
To detect.
Okay. So what in mammography, what we have been using the AI, my apologies, it's called CAD. It's called CAD. It's the computer aided detection. And that has been used. I think when I started with Cedars-Sinai back in 2004, 2005, we were already using AI, like computer aided detection, where it does highlight areas in the breast that the physician may have potentially missed. So I'm sorry, we do use that in mammography, the CAD, computer aided detection.
Oh, yeah, that's really helpful.
Yeah.
All right. Does anybody else have any questions or comments? All right. Well, thank you
Okay.
so much.